With a single unconscious action, the virus finds its way into the human body. Inside the lungs, the SARS virus multiplies uncontrollably, destroying the ability to breathe. Vital signs plummet, every alarm sounding like the edge between life and death. Behind protective gear, a doctor's eyes know that one decision can change everything. In Guangdong, a normal morning begins with the rhythm of everyday human life. Crowded markets become the intersection between humans and the natural world.
Fresh mackerel, very cheap today.
Within captive wild animals, the SARS virus silently persists.
How much for the big one?
Humid environments allow the virus to adapt and continuously mutate. Unprotected direct contact opens the pathway for transmission to humans. The moment the virus crosses species, marking the beginning of the SARS outbreak. The SARS virus begins spreading silently through crowded streets, where close human contact happens without awareness. Unconscious actions, like touching the face, unknowingly become gateways for the virus to enter the body. The SARS virus attaches tightly to respiratory cells, bypassing the body's natural defense barriers. Inside the lungs, the virus rapidly replicates, damaging alveoli and reducing oxygen exchange capacity. The patient develops fever, fatigue, and dry cough, the first signs of a dangerous illness. Within confined family spaces, the risk of transmission rises before the patient is brought to the hospital, where healthcare workers in full protective gear receive them under strict control. Isolation wards are activated, with doctors and nurses in protective suits working under intense pressure to contain spread. Clinical samples are carefully collected, each step following strict biosafety procedures.
Almost finished.
Inside the laboratory, fully protected technicians begin analyzing samples to identify the exact pathogen. The virus continues uncontrolled replication, penetrating deeper into the human respiratory system. Lung X-ray images reveal widespread damage, signaling the risk of severe respiratory failure. Hospitals enter emergency mode, with protected medical staff moving constantly between critical cases. Through the night, hospital lights remain on, signaling a growing global health crisis. The patient's condition worsens, breathing becomes rapid and unstable. The oxygen mask becomes a fragile barrier between life and respiratory failure. Healthcare teams in full protective gear urgently coordinate around the patient.
Let's optimize his fluids first.
Vital signs deteriorate rapidly, triggering critical warning alarms. Severe lung inflammation and fluid buildup obstruct oxygen exchange. Medical staff adjust oxygen flow in hopes of sustaining breathing.
It's all right, sir. Just
Violent
relax.
coughing reflects the relentless viral assault. Doctors make rapid decisions as acute respiratory failure looms.
We need to stabilize him before the arrhythmia returns.
Medications and fluids are administered to support failing organs. The patient is urgently transferred to intensive care in critical condition. ICUs become overwhelmed as severe SARS cases rise hourly. Ventilatory support is connected, replacing failing lung function. Every ventilator reading determines the patient's chance of survival. Behind sealed protective suits lies mounting exhaustion among medical staff. CT scans reveal increasingly widespread lung damage. An excessive immune response causes the body to harm itself. The patient falls unconscious, fully dependent on mechanical ventilation.
disgusted.
Medical teams vigilantly monitor every subtle change in condition. ICU corridors remain awake through the night under constant tension. In the doctor's eyes, exhaustion blends with determination to save lives. Doctors adjust ventilator settings to optimize oxygen delivery while minimizing further lung injury. Arterial blood gas results are closely monitored to assess the body's oxygen exchange efficiency. Antiviral medications are administered intravenously under strict biosafety procedures. Inside lung cells, antiviral agents begin inhibiting SARS virus replication. The patient is deeply sedated to reduce oxygen demand and allow lung recovery. The ICU team conducts bedside rounds, coordinating every treatment decision at a critical moment. Vital signs are continuously checked, as even small changes can be life-defining. SARS treatment protocols are carefully reviewed using daily updated clinical data. The ICU atmosphere stabilizes as vital signs stop showing dangerous fluctuations. Blood oxygen levels slowly rise, marking the first sign of improvement. Lung inflammation decreases as fluid is reabsorbed and respiratory function gradually recovers. The patient begins breathing independently as ventilator support is reduced. Doctors share cautious optimism, fully aware that relapse risks remain. The night shift continues quietly as medical teams maintain constant monitoring. The patient slowly regains consciousness, showing early signs of neurological recovery. Nurses reassure the patient with gentle gestures, helping them adapt to the ICU environment. Vital signs remain stable, signaling that the critical phase has temporarily passed. Morning light enters the ICU, carrying fragile hope for survival. The patient begins breathing steadily on their own as oxygen support is gradually reduced. After extubation, the patient coughs weakly, reflecting ongoing lung recovery.
You're doing slow. You're doing great.
Oxygen levels remain stable, showing the body adapting without mechanical support. Healthcare staff gently adjust oxygen support to assist without overloading the lungs. The patient sits upright, still weak, but with noticeably improved awareness and reflexes. Breathing exercises begin to restore lung capacity and respiratory muscle strength.
And bring them down gently.
Each deep breath helps the lungs re-expand after prolonged severe injury. Doctors monitor recovery progress while assessing potential post-SARS complications. The ICU atmosphere eases as more patients pass the critical phase. The patient is transferred to an isolation recovery ward for continued monitoring. In the quiet isolation room, the body gains time to fully recover. Oral medication and fluids support physical recovery after severe illness. Resuming independent eating signals gradual health recovery. Doctors explain the prolonged recovery process and the importance of post-discharge monitoring.
Following the physical therapy guidelines.
Strict disinfection procedures are carried out to prevent cross-infection. Tests confirm that the SARS virus is no longer present in the patient's body.
Logging the data now.
Negative results mark a major milestone in overcoming the disease. The patient practices walking again under supervision, slowly regaining strength. Hospital corridors fill with daylight, reflecting hope after dark days.
Recovery rates are excellent news for the ward.
The patient meets discharge criteria and receives instructions for home isolation and health monitoring. Doctors hand over documents and medications, emphasizing adherence to post-treatment protocols.
Got it. Thanks.
Wearing a mask, the patient steps cautiously back into the outside world. Communities adapt by wearing masks and maintaining distance in daily activities. Community health workers conduct temperature checks to detect early infection risks.
Next person, please step up to the line here.
Hand washing with soap becomes a critical habit to break transmission chains. On public transport, mask wearing reduces the risk of respiratory transmission. Surface disinfection is widely implemented to protect public spaces. Clear public health messaging helps people understand and cooperate with prevention
Continue to wear
measures.
your masks and maintain social distancing.
Urban life slows down, aiding efforts to control viral spread. Scientists continue analyzing data to refine SARS containment strategies. Declining case charts demonstrate the effectiveness of intervention measures. Medical teams assess containment outcomes and prepare for future scenarios.
The downward trend is significant. We should prepare the report.
At home, hygiene and prevention habits become part of the new normal. Children learn proper hand washing, building early awareness of disease prevention.
Now rinse it all off.
Hospitals gradually return to stability as emergency cases significantly decline. Silent glances among colleagues reflect unity after the crisis. City lights return, carrying hope for recovery after the outbreak. SARS is contained, leaving profound lessons on vigilance and global health preparedness. Epidemiologists analyzed the entire outbreak to understand how SARS spread and was ultimately contained. Global maps reveal the wide-reaching impact of SARS within a short period.
We are now facing a global pandemic.
Public health decisions drawn from real experience help shape future strategies.
Director. My team is ready to mobilize.
Virus samples are carefully preserved for research and long-term preparedness. Case records become valuable data for future medical generations. Proper PPE donning procedures protect healthcare workers from infection risks. Health screening checkpoints remain in place to detect early resurgence risks. Health controls at transportation hubs limit cross-border transmission. Public health information becomes a familiar presence in shared spaces.
We should continue wearing masks in crowded areas.
Media plays a key role in raising public awareness.
Plant-based proteins and regular exercise.
That's interesting. Maybe we should try that recipe they mentioned.
Early health education helps younger generations understand epidemic risks. International collaboration is strengthened to confront emerging
We are
threats.
seeing the same anomalies in our trials.
Scientific publications on SARS lay the foundation for future virus research. Disease surveillance systems are improved to detect abnormal cases early.
Feed is clear. We are ready for phase 2.
The quiet sacrifices of healthcare workers are remembered as part of history.